When I first got into chiropractic, I didn't think that I could be addressing anxiety or post-traumatic stress disorder or PTSD. They are growing at epidemic numbers of patients that have that. I had a case recently in which I'm really proud of. The woman came in, she had fell down the steps. She has always had problems with anxiety, but her anxiety went through the roof. And so she had areas of her neck that we treated. We treated for her for concussive effects of the brain. And as we were treating and normalizing all her functions from that injury, falling down the steps, her anxiety started going away. And actually her anxiety went completely away from where she was having it before. She couldn't be alone in the home. When her fiance would be away for a while, she just would freak out. She couldn't handle it. But as we were treating her, her anxiety started going away. So what I did was I started looking at the brain a little bit more intensely about how a person can have a fall or a trauma to the head or a concussion, and how that affects our behavior and how that affects our stress levels. We know that in the nervous system we have two autonomic functions, which means that our body functions autonomically. We have the fight-flight system, which is called the sympathetic nervous system, and then we have the parasympathetic system, which is our relaxation system. So we have two systems. We have a fright-flight, and then we have the parasympathetic, or the resting system. And if they are out of balance, right, and if they're out of balance neurologically because our control systems are not functioning properly, then you're going to have anxiety because you're always in a fright-flight type of aspect. The other thing that I see with anxiety is your breathing mechanism changes. We have a diaphragm right here, and we need to use our diaphragm to breathe because we get the most oxygen in and the most oxygen out. And it's a very relaxed, efficient way of breathing. When a patient comes in and they're under high stress and they have neck pain and they have headaches and all these other things, they usually don't use their diaphragm. They use their chest and they breathe like this. And they use all their secondary muscles in the neck and in the ribs to breathe, and they get sore and the neck gets sore. So when you change that balance from fright-flight to rest, then we see anxiety start to ease without drugs. Drugs, drugs, drugs you get from the medical profession. At the Back and Neck Pain Relief Center, you get us looking at you as a whole person, your brain, your spine, your extremities, your physiology. I have another case in which a woman came in. She really didn't need any adjusting. It was really a nutritional thing that we did with her. We did a nutritional test. We found out that she had high yeast in her system, and that yeast plays havoc on people emotionally. So once we got rid of her yeast, no anxiety, back to work, doing what she can. And you can go on our Facebook page and read about this lady on our Facebook page. Thank you. Have a great day.